Hello, hello. This is for Professor Steph's class, HIM 2652. This is MARV Consulting with Ariel, that's me, V, Megan, and Rodney. And this is our summary. We are currently in Canada. There are 10 provinces and 3 territories each with its own insurance plan and are responsible for developing their own electronic information systems. With this separation, achieving nationwide interoperability of electronic health records could be difficult. To successfully implement EHRs, it has been found that the quality of the design of the user interface and the functionality of the offered features can affect the outcome. The systems fit within the organizational culture and its usability of the system should also be considered. The problem we found is that there is a lack of uniformity in the nationwide implementation of electronic health records in Canada. There needs to be a cultural shift that starts with individual organizations being able to fully implement and utilize EHRs. With the lack of uniformity and interoperability, patients that go to another province or territory end up having incomplete and inconsistent records. This is a problem if an emergency happens and a treating facility does not have access to the records because a primary care doctor still uses paper records or has an EHR that does not have interoperability access. Canada at the current time, again, has 10 provinces and 3 territories that each have its own insurance plan and are responsible for developing their own electronic health information systems. Each province and territory has a national funding and support through Canada Health InfoWay. Unfortunately, most Canadians do not have access to their electronic health information. Canadians not having access could be for multiple reasons. One main reason is switching doctors or having many doctors with different specialties, so patients have many different places to access portals. Having all these places to have access these records can be a lot and easy to forget about some portals. Alberta, Ontario, and British Columbia each have electronic health records in place with patient access. However, Ontario has multiple different EHRs, so this means multiple portals for patients in the province to have to log into. Canadians have been asking Canada to create a new system for national health records. Every country has different standards of what they need in an EHR system. In Canada, a national strategy for implementing a nationwide EHR does not currently exist. A nationwide EHR would ensure interoperability between systems that have been developed or obtained from different vendors, but still meet specific national standards. A few things have been found to be successful in implementing EHRs. The quality of the design of the user interface and the functionality of the offered features can affect outcome of implementation. The systems fit within the organizational culture and its usability of the system should also be considered. Some benefits of officially adopting an EHR through facilities in Canada are quality of care, fewer errors, increased patient satisfaction, easier access to information, lower cost due to effectiveness, monitoring performance, ensuring regulatory compliance, enhancing data collection, enhancing documentation, expanding flexibility for future growth, and improving enterprise-wide data integrity are some project goals that a Canadian facility may have. The improved service, quality, and flow of patient care by adapting an EHR are most significant benefits of enhancements. Multiple areas are influenced by the utilization of such precise and systematic information flow through the procedure. By using electronic evidence and clinical practice guidelines, it has been observed that technology enabled process changes contribute to the facilitation of best practices. Clashes can likewise emerge during process distinguishing proof, planning, and re-engineering where the EHR proposed process changes frequently uncover work processes that are excess or in struggle with other departmental practices. It is essential to the success of the EHR project implementation to address conflicts in an amicable manner, regardless of the cause. Next up, we have V.
Thank you, Ariel, for your introduction. My name is Verusca Granadillo, and I'll be taking over the presentation, starting with innovation. Innovations in the field have been expanded in a few directions due to the pressures of productivity, person-to-person time with patients, and an electronic health record system flaw. Healthcare workers' burnout has become a global problem. An EHR user interface lack of usability can necessitate additional steps for users to complete a task. EHR innovations are a constant necessity for enhancing the physician experience. An application for mobile documentation, auto-populated EHR patient summary from usual test results, reduces inappropriate testing ordering with physician alerts, and a dashboard system for safety alerts are two examples of innovations that have reduced the number of clicks required and made it possible for healthcare professionals to invest less energy on PCs and additional time with patients. Some innovative updates to an EHR system have the potential to enhance patient protection, reduce burnout among healthcare providers and staff, and boost job satisfaction. In addition, they have the possibility to improve the EHR experience with more practical ways of chart documentation, reviewing, ordering, and patient security. Additionally, they have the potential to simplify health information management and workflows. Now that we understand innovations, we can apply it to a change of management. A study mentioned by the core and how the implementation of a project known as an electronic healthcare record says it has an impact on a healthcare organization's procedures. A crucial factor that can have a significant impact on the success of such implementations is the capacity of healthcare organizations to modify and change operations to leverage the functionalities of an EHR and improve healthcare status and monetary production. Implementations of electronic healthcare record, also known as EHRs, necessitates modifications to fundamental organizational procedures, and effective change management is crucial to their success as well. The success of health IT applications is significantly motivated by factors related to the remodeling, the administration, and facility procedures changes. Information system adoption, utilization, and net benefits were also altered by customer-patient engagement disclosing, coaching, prioritized selection, and technical keep-up. Suitable adjustments, accuracy, directional compliance, efficacy, a capable champion to the project, mutual assurance, and the role that the healthcare member point of view plays is influencing the success of health information implementation and also significant predictors of organizational change, which ultimately it leads to the adoption of IT-based changes. And now we have our SWOT analysis, but first of all, what is a SWOT analysis? It is a strategic planning and a strategic management technique used to help a person or organization to identify strengths, weaknesses, opportunities, and threats. And it is related to the business competition or project planning. And it's also sometimes called situational assessment or situational analysis. For our SWOT analysis, we got in our strength, information storage is low volume, reduction in duplicate testing, increase in service delivery speed. For our weaknesses, we have the lack of rapid profit, time-consuming and difficult to link legacy system information to new system information, and increased workload for healthcare providers. For opportunities, we have service records that are accurate, ensuring the system's integrity as a whole, works as a legal document regarding the kind of service that was provided. And for our threats, we have insufficient strategic planning for the EHR, resistant to using EHR on the part of medical professionals or other clinical staff, and lack of funds for the creation, implementation, and use of electronic healthcare record. Thank you so much for watching my part of this presentation, and now Megan will be taking over.
Thank you, V, for that introduction. My name is Megan, and I'm with MARV Consulting, and I will be discussing some of the obstacles that can come up when implementing EHRs. So there can be many. I'm going to talk about some of the big ones. We'll be talking about cost, culture shift, interoperability, and maintaining the privacy, security, and confidentiality of patient health records. So, as I said, there can be many obstacles to implementing an EHR. Number one is the cost. Computer and hardware costs have decreased over the years, but there is an increased cost for software engineers and health informaticists. They will be necessary for the customization of the system, collaborating with users to gain buy-in, performing regular training, and ongoing maintenance. So this is a necessary cost. A culture shift will be needed to be able to fully utilize the EHR, which will increase the value of the health data that is being shared. Another obstacle will be interoperability. To achieve this, there needs to be a level of standardization between organizations to best protect the integrity of the data and ensure the information sent between organizations remains intact. Finally, the privacy, security, and confidentiality of patient records needs to be maintained. Policies and procedures, regular staff training, and audit processes should be put in place to keep those records secure. Now I will be going over impact analysis. We'll be talking about buy-in. We'll be talking about what an integrated EHR is, IT staffing, and then I'll leave you with a little fun fact. So the success of the EHR implementation depends on the buy-in of multiple organizations and all stakeholders. An integrated EHR will have a clinical data repository, or CDR, a clinical decision support, or CDS, computerized provider order entry, CPOE, and controlled medical vocabulary, or CMV. Other systems can also be integrated, like laboratory information systems, or LIS, pharmacy information systems, or PIS, and the radiological information systems, or RIS. So these systems can increase data management speed and accuracy, increase patient safety, and reduce medical errors and decrease costs. With the IT staffing, it might be necessary to increase that budgeting. And so the fun fact for you is that the 4th generation EHRs have reduced preventable errors by 90%. And finally, I will be going over some observations from implementing EHRs. We'll be talking about functionality, which includes features, design, and usability, the fit within the organization, and what full utilization will do for you. So the functionality of the offered features and the quality of the user interface can affect the outcome of implementation. The EHR systems fit within the organizational culture, and the usability of the system should be considered. Fully utilizing the EHR will increase the value of the data that is being shared. MARV Consulting is here to help your organization embrace the use of EHRs to help deliver quality care, control costs, and improve efficiency. Up next, Rodney will be talking about MARV's proposed strategy and recommendations for your organization.
Good afternoon. I'm here to discuss proposed strategies and recommendations for Canada provinces. Here to conduct workflow analysis, engage all teams, organize go-live support teams, organize a plan rollout strategically, embrace change, and train all staff. Implementations. How can we improve the quality of healthcare in Canada? First of all, we need to consult with all stakeholders involved to foster a plan to serve all levels of government, provinces, and territories. The most important of this implementation is cost-effective measures for leadership. Implementing systems across Canada for continuum of care decreases obstacles and interoperability among all physicians. First, Canada to connect interoperability, each stakeholder must agree and advocate for internal and external change. A proposal should begin once a committee is formed to discuss proposed financial incentives at least 6 months in advance before a vendor is selected, or once each vendor is narrowed down to at least 3 choices. Secondly, once a consulting member has been contracted by the main topic of conversation, should be solely on interoperability for all physicians. That's where we come in, my team. The next step is to define the change management and workflow processes and design the future promote system upgrades depending on the geographic location within Canada. Planning and selections. EHR selection is crucial before discussions even begin. Finding the right fit for the organization is a key strategy. Discuss cost factors with all stakeholders involved. Allow all committees to input all their versions of recommendation that fits and what might not fit. This might take a while to research the various options to choose the best one that fits. My team focuses on interoperability in the Canada Health Info Systems. As an independent non-for-profit organizations funded by the federal government to focus on availability of IEHR data authorized by healthcare professionals with the ability to track 6 core IEHR domains, which is client registry, provider registry, diagnostic imaging, and laboratory test results, etc. A culture barrier that we may have to deal with is a culture shift for Canadians. Consultation plays a key role here because it's very important to make sure that all stakeholders, team members are trained and communication is clear. So the effect of the age or computer experience do not hinder progress needed moving forward. Steps should be taken well in advance with required training to less experienced staff is a very important phase. Adaptation and implementation. Consult with stakeholders about this transition to this new HR system. For this will be the time to allow all committee members to make sure that all staff and patients are involved in this process and have the training required before go live is implemented. Optimization and workflow redesign. Feedback is crucial once a selection has been made. Vendors, stakeholders, and consultation teams must now optimize and design the best fit for the organization. Implementation plan recommendations. Plan and consult every outline of the task will need to be completed during this process, given that Canada has many provinces. Canada currently has 10 provinces and 3 territories, which is a large area to cover. Implementation teams consult and guide. Project managers consult and communicate with selected vendors and staff concerning progress of the implementation plan. Each EHR super users consult with experts in developing workflows, ensuring staff are dealing with any issues that may arise, which includes lead physicians, lead nurses, billing advocates, application designers, developers, application analysts, and software testers. The best advice for a successful implementation of this process. At this point, vendors, stakeholders, staff, and patients involved for this implementation of Canada medical records should ensure HIPAA compliance, making sure all security measures are in place, consult with all stakeholders and brainstorm possible problems that may arise, consult and collect feedback from a committee, all committee members during the process to ensure customization fits the intended timeline, consult and measure metrics such as return on investments. At this point, stakeholders is the pivotal success.
I hope you enjoyed our MARV Consulting presentation and that you better understand the possibilities of that EHR adoption hold for your organization and some of the changes that will need to be made to fully utilize the system. MARV Consulting is here to help. We are uniquely equipped to achieve a culture shift that allows for full utilization of EHRs, as well as having systems in place to achieve and promote interoperability between organizations. The following 2 slides are the references used for this entire presentation.